More great news this week when it comes to getting a coronavirus vaccine to the people. Welcome back to emergency medical physician, friend of mine, also personal doctor of mine, Dr. Todd Dorfman. Dr. Todd, the government just needs to decide who will get the vaccine first. I think the CDC came out and recommended all first-line responders get the vaccine first. What are your thoughts on this vaccine and how effective you think it'll be?
Yeah, well, it's a great question because I think it's multifaceted. The vaccine in and of itself is incredibly effective. You know, having a vaccine at like 95% roughly is among some of the best vaccines ever. Now, the key, of course, is that you have a great vaccine, you have to get people to vaccinate. So that's, you know, the first step. Generally speaking, even with our best vaccines, only about between like 80 and 90% of the population actually vaccinates. So that's challenge number one, to see how many people can get vaccinated. The other challenge is exactly what you alluded to, the allocation. And I think it makes a lot of sense to give it to first-line healthcare workers. But I think, you know, that has to be further determined. In other words, someone who's in an office mostly doing Zoom health or any other sort of telehealth situation is really not a first-line worker compared to like a staff in an emergency department, a staff in an intensive care unit. They have to be first. The CDC went over decreasing fatality rates because the highest, you know, fatality rate is in this age group and multiple medical problems in nursing homes and long-term care facilities. And then they went with who's going to treat all these people. And I think that's a very reasonable first approach, frankly.
So, Todd, you're a frontline worker. You've spent time in emergency rooms. I've seen you in action there. I mean, you're rubbing up against a lot of people who may be infected. Any reluctance for you to get that shot in your arm as one of the first rounds of people getting it?
No, honestly, I have fairly good confidence in how this is being vetted. I think that, you know, the headlines and the scientific kind of press is one thing, and there are, you know, thousands of documents underneath the surface that are being investigated by the FDA. I also think it's really a sort of an important piece that the UK has just approved the Pfizer vaccine, because they're really an analogous institution to the FDA in terms of their thoroughness of approval. So I would get the vaccine as offered to me. Now, Eric, having said that, it's a brand new type of vaccine. It's an mRNA vaccine, and that's really not been out in the public before. So there's a little bit of risk there, certainly, once it's distributed to the public.
And I think what people need to understand is that there is, we think of all the drugs that have been approved, FDA approval for years, and then later be found to be somewhat dangerous, only to be pulled off shelves. And we're hoping this isn't one of them. Final thoughts on the vaccine, Doc?
Yeah, I think the vaccine's a fabulous thing. I think that's the Pfizer. The Moderna one will come out next. I think the real issue is distribution in numbers and how fast we can produce it and how willing people will be to accept the vaccine, because that's really what's going to create a defense for the United States.
All right, herd immunity on the way. Dr. Todd Dorfman, always good to have you on.
Thanks very much, Eric. Pleasure to be here again.